Can heart patients fast? This is a question that is frequently asked of us. You see, with the arrival of the holy month of Ramadan, the recommendations we make to patients regarding the treatment of heart diseases are generally derived from guidelines and international protocols that are accepted by all doctors worldwide. These guidelines and protocols are mostly European or American, but unfortunately, we do not have specific guidelines or protocols regarding fasting for heart patients. Therefore, the information we obtain and the recommendations we make to patients are based on studies conducted in this area. 3 major studies have been conducted in Islamic countries, including Turkey, Saudi Arabia, and the UAE, have been conducted in recent years regarding fasting in heart patients. These studies examined about 18,000 heart patients and monitored them over a period of approximately 5 to 10 years to determine whether fasting is harmful to them or not. The majority of these patients did not experience problems with fasting. This is the general overview, but regarding the details. The first group consists of patients with hypertension. 90% of patients with high blood pressure can fast without harm, provided that their blood pressure remains within the normal range, with the use of antihypertensive medications, meaning it should be less than 140-90 mmHg. However, patients who need to take 2 to 3 doses of medication to control their blood pressure and have uncontrolled hypertension should not fast, as it is harmful to them. The second group consists of patients with heart failure. This means their heart's pumping ability has weakened, leading to shortness of breath during daily activities, and exertion, experiencing palpitations, and developing cardiac symptoms. These patients are divided into 4 groups. The first stage or stage 1 to stage 4. Those in the early stages, meaning stage 1 and 2, do not have any restrictions on fasting. However, those in stage 3 and 4 are individuals who, with very little activity, during daily tasks and household chores, experience chest pain, shortness of breath, and palpitations. Fasting is harmful to them. Therefore, heart failure patients, if their symptoms and condition are completely stable and they do not have any cardiac symptoms, and we say, well, in other words, their condition is stable with the medications they are taking, fasting is not a problem. But for those who are in the advanced stages of the disease and experience symptoms with the slightest activity, fasting is prohibited for them. The third group consists of patients who have coronary artery blockages. For these patients, due to the blockage, we have placed a stent, or what is commonly known as a spring, meaning they have undergone open heart surgery. If the placement of the stent or spring occurred under emergency conditions, meaning the patient had a heart attack, they are not allowed to fast for 3 months, as fasting would be harmful to them. However, if the stent or spring was placed under elective or non-emergency conditions, they are not allowed to fast for 6 weeks. But after that, they can fast. This is conditional, provided that the patient is asymptomatic from a cardiac perspective, does not experience chest pain or palpitations, is stable, and has no issues with walking or daily activities. Patients who have undergone open heart surgery are not allowed to fast for 3 months after the operation, but after 3 months, they can fast provided they do not have any significant clinical symptoms. These are the general points I mentioned. Patients with stable conditions from these groups, if they decide to fast, can divide their medications, taking part in the morning at suhoor and part at iftar. They can divide them and no problem will arise. However, the important point we need to know is that each patient is different. Some patients have certain special conditions that only their treating physician is aware of. Therefore, it is absolutely necessary for them to consult with their doctor regarding fasting and to obtain permission to fast from their treating physician